With the passage of FSMA, FDA now has extremely broad powers, and there's new requirements that are being imposed on food companies throughout the country. And those companies throughout the nation are asking themselves, are we really ready for FSMA, or is there more that we still need to do? And that, of course, is a function of comparing what we currently have in place against what the FDA will expect. So in addition to doing a brand protection audit for our colleagues and with our colleagues, we can also do a food safety gap assessment. And in a single day, we can come in and assess your operations, your written programs, and look for those areas and identify those areas where you're already compliant with FSMA or the prevailing industry standards. Number one. Number two, we can also identify where certain gaps might exist between what FDA will expect and where your current programs currently are. And number three, we'll identify, in light of those gaps, the specific recommended enhancements that we'd make to your programs to make sure that, in fact, you are truly compliant with FSMA. It can be a very efficient, very easy process. Give us one day and we'll make sure that you're compliant. But setting aside the written programs, we also want to make sure that we're not exposed to additional regulatory, criminal, or even civil liability. And I think it's very, very critical for all food companies to understand that FDA is going to visit your facilities, it is going to scrutinize your operations, and it is going to be doing microbiological profiling of your food processing environment. Well, what does that mean? Well, when the FDA does come and they review your written programs, make a determination whether you're compliant, and they walk through your facility to do their inspection to make sure that there's no conditions that they observe that are in violation of the regulations, they're also going to be taking microbiological samples of the floors, of the drains, of your food processing equipment. And those samples are going to be tested for pathogens like Listeria or Salmonella. And if the FDA finds those pathogens in the environment, it's going to compare them against its national database, PulseNet, of all of the ill case patients who have gotten sick over the years from contaminated food products. And if FDA finds a match between a strain that it finds in your facility and one of those case patients, a couple of things can happen. Number one, it could trigger a very large recall, even if the illness occurred years ago. Number two, the FDA may make you shut your facility down. So it's critically important that we understand when FDA shows up for its first FSMA inspection, that not only do we have the written programs in place that are compliant, but that we've also done our own microbiological profiling of our facility and our equipment, that we understand what pathogens might exist, that we've placed ourselves in a position that we can eliminate them and get rid of them. And if we do it right, we can do that under the veil of the attorney-client privilege, so that information is only available to us. And then we can eliminate that problem so that when the FDA finally does show up, we understand and know what does and doesn't exist in our facility, and the agency isn't going to be the first one to tell us. So are your written programs enough? Is your environmental testing and monitoring programs enough? Well, we're here to help you find out.